Hi, I'm Dr. Brett Langston. I'm a prosthodontist and the owner of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia, and I'm here to help you watch your mouth.
Down in Brookhaven with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
While single-tooth dental implants are one of the most successful things we do in dentistry, sometimes things do happen and we do get failures. One of the most common failures for an implant crown is the screw breaks or fractures or loosens. This is a very common failure and probably the most common thing we see when implants fail. So a quick reminder on the breakdown of what an implant is and how this all works. So you've got the implant, which is the titanium screw that goes down in the bone, and then you've got the custom abutment, which is basically a lab fabricated piece that mimics the inside of a tooth. And then you've got a screw that goes through that goes down into the implant and tightens that down. And then you've got the crown, which looks like a tooth that goes on top. So a lot of times, the forces and the stress in the mouth can cause that crown that's on the implant to start to move around a little bit. And those forces are distributed to that little tiny screw that's kind of holding the whole apparatus together. And what can happen is that screw can actually loosen up a little bit. And so we'll have patients call in and say, I have a crown on my implant and it's moving, like what's going on? Not a problem, come in and see us. Basically what we need to do is make a small access to that screw by cutting a little tiny hole through the chewing surface of the implant crown. And in the best case scenario, we can access that screw and we can just tighten it back down to the manufacturer's suggested torque value. And then we seal that up and you leave. The tooth is stable, the hole is sealed, everything's good to go, no worse to wear. Sometimes it's a little bit more involved than that. Sometimes if the screw is broken, we have to go in there and we have to actually drill that same hole to access the screw, back that screw out, take everything off, make sure it's okay, and we can either order a new screw for the custom piece, or if we have one on hand, we can put that screw in and tighten that screw down and then seal everything back up. So that's the best case scenario if you have an implant crown that's a little bit loose. Sometimes if the failure is on a bigger scale, as in the implant that's in the bone or a fracture in the abutment piece, it's going to be a lot more involved solution. But generally speaking, when you have an implant crown that's loose, the most common cause is a loose screw or a broken screw. If it's just the screw that needs tightening, the whole process can take less than an hour. We can get you in, access everything, tighten it back down, seal it up, back on the road, good to go. If it's something more involved that involves the recreation or making of a new crown or a new abutment, that process generally takes about 3 to 4 weeks. But again, the most important thing is as soon as you feel something's off or as soon as you feel that a crown on your implant doesn't feel quite right, give us a call because we need to get you in as soon as possible to take radiographs to inspect your mouth and kind of see where that issue lays, whether the fault is with that tiny little screw or something on a kind of a bigger scale. So if you have a screw loose, give us a call. Whether you're in Miami, Kentucky, London, Asia, wherever you are, give us a call. I would love to have you come in. We take a look at it. We'll get you fixed up. And if we can't tighten it that day, we will come up with a solution to get you back to good. I'm Dr. Brett Langston. I'm a prosthodontist, owner of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia. I'm here to help you watch your mouth.